We do. Yeah, we're still missing a couple of committee members, but yeah, we're good to get started.
Okay, thanks, Katie. Welcome, everybody, to the March Finance and Revenue Committee meeting. Good to see all of you. Really excited to welcome our new consultants, but we'll start with roll call. Could you do that, Katie?
Yes, definitely. Starting with Cheryl Ramirez
Here.
and Chunwei Chi,
Here.
Richard Gibson,
Here.
Jeff Goodman,
I saw him.
Jeff Goodman is here.
awesome. Thanks, Jeff. John Santa,
Here.
Charlie Swanson,
Here.
and then Chris Hogan is unable to join us, and Bethany hasn't joined yet.
Okay.
But you can take it from here. No problem.
All right, so we're going to just quickly review the agenda and see if there are any announcements. So first we're going to, of course, like usual, review the feedback from our last meeting, which was exactly a month ago. We're going to introduce our consultants from the Echo Northwest team. Very happy for them to be with us. At the last board meeting, Chunwei did a really great presentation that I felt could serve as the basis of our tax discussion and decisions. And so he's graciously accepted going through that presentation again. And as usual, I know some of you have seen it, and of course we can talk during, if you have a question or comment during the a slide, you can certainly raise your hand and we'll address those questions and comments. Then we'll go to the tax structure considerations from that basis. That'll be a really interesting discussion. And then on to meeting reflections, next meeting topics. And I don't believe we have any public comment as of yet. So we did receive, I believe, 3 written public comments. Hopefully you all were able to read those. So with that, let's go to the summary of feedback. Oh, wait. The timeline. We always need to go through the timeline. So here we are in March, talking about revenue options and cost targets. So that's where we're at. We'll show the flow chart. So we're in the yellow boxes right there. I just wanted to note that we need to close the loop on the administrative savings. I think we've had some problems getting the whole group of key informants together on a panel. So I'm not sure, I'll let Jenny give us an update near the end of the meeting on where we're at with that panel. We're hoping to schedule that group next month so we can close the loop on the administrative savings. So now I'll toss it to Jenny for the summary of feedback.
Thanks, Cheryl. So in last month's meeting, the committee agreed to explore income taxes and payroll taxes as new revenue sources. The committee suggested the following revenue options to explore. So corporate tax, premium tax, health insurance tax, fees, alcohol and tobacco, and existing reserves. And these are definitely things that we will be continuing to review now that we have our consultants on board and with support from the Legislative Revenue Office as they're able during session. And further discussion is requested around the nature of taxes, which we'll be taking up today. And clarification is needed around devising a tax on income that is not subject to the kicker. And we have been talking with the Department of Treasury, and I reached out to our counsel at the DOJ, and they are looking for a tax specialist for us so that they can provide us with some support around this. And the operations committee is moving into looking at the Treasury fund. And so Treasury is also talking to us about some of the considerations that we'll need to be making as we move toward what kind of fund would be created in the Treasury. So those conversations are happening. And hopefully by next month, we'll have some more concrete information and somebody from DOJ who can provide a tax opinion.
Jenny, just a quick question on that. So are you saying this issue with the kicker will be more in the operations committee? Will they be working on this, or they're just working on other issues regarding the Department of Treasury?
So the operations committee is working on a different issue in the Department of Treasury, and that's about setting up what kind of fund would be set up within the Department of Treasury. Senate Bill 1089 requests that or says that a fund will be set up in the Treasury Department. And after having conversations with the Department of Treasury, there will be some impact in terms of how the administrative structure of the organization that runs the health plan would be set up, and the number of payments and how payments were coming in and out. So that's still an area that we're a little bit gray on, but the operations committee, that's within their scope of work to sort that out, look through and start working with Treasury to understand what considerations we would need to make and what other committees would need to make those decisions or recommendations. And then there's also the piece from DOJ in terms of having an opinion from their tax department to give us more information about how you would structure something that was separate from the kicker. So both Treasury and the tax and DOJ will probably be giving input in terms of what that structure needs to look like to avoid the kicker and be able to support what the health plan needs to do.
Okay.
So it's going to be finance and revenue. It's going to be operations and
Okay.
a little bit of plan design as well.
Oh, all right. Well, thank you for clarifying that a bit more.
Sure.
And it looks like John has his hand up. John?
Yeah, I just wanted to put on the radar screen, I think we've talked about it a bit, but the issues around reserves. And in particular, the nature of the reserves in existing healthcare companies of all sorts, if and when there was a transition like we're talking about. And I think there's been some very interesting conversations, and for me, a learning experience following the input around the Legacy Foundation, the creation of the Legacy Foundation as part of the Legacy OHSU merger, and identifying charitable assets versus operational assets. So I'd just like to put that on the radar screen as something I think that this group should spend a bit of time on, because it's billions of dollars. It's billions of dollars.
Thanks, John, for bringing that up again. I might defer to Jenny or even potentially our consultants on where that fits in and when we should be making some sort of a recommendation on the reserves. Do you want to say anything about that, Jenny, now, or do we just put it on the list?
I think a little bit. I can't speak to where that would fit in right now, but I do think it's something that we should have a conversation about with our consultants and with the committee to understand and maybe get some more information, because John, I know you've mentioned it before, the Legacy Foundation at OHSU that happened through their merger. Get some more details on that to understand how that worked and look more broadly at this particular topic. And I think once we start to dig into it, we'll have a better idea of where it fits in terms of the conversations that are being had. And John, anything that, or any additional information you want to provide or suggest as to where you would like to have the conversation or where you think it fits in, we would obviously be happy to have that conversation and take your advice there.
Yeah, just a clarification. It hasn't happened at the proposed Legacy Foundation. It's a proposal that Legacy has made, and this is all up in the air. And that proposal has generated input from community organizations, from Oregon foundations, and a variety of other folks around the nature of reserves. Both at a Legacy, which is, primarily a hospital and physician group company, and at insurance companies, because Legacy owns half of Pacific Source. And so this is all going to be sorted out. And I suspect that the Attorney General is watching this carefully, as DCBS should be, because it strikes at the nature of Oregon nonprofits and their commitment to charitable activities, to the community, et cetera. So I just wanted to make sure that nobody knows yet what the outcome of all of this is going to be.
Thanks for bringing this up, John. And you have sparked other comments. So we'll start with Charlie.
So I would say that it's certainly this question certainly fits in with the transition process, and it's going to be extraordinarily important for that.
Yeah.
It likely also fits in with what we're going to be doing because it could affect what we think we need is in terms of revenue. And I would say it's wider than just nonprofits, that it should involve for-profit companies that have been paid money that they've put into reserves by the state, paid money by the state that they put into reserves. So, and maybe even more widely than that, maybe beyond just what the state has paid. So it's a really important question. It clearly is part of the transition and likely is part of what we need to be doing. So that's my opinion.
Makes sense. Thanks, Charlie. Chenwei?
In our in our last meeting, I mentioned Taiwan's national health insurance with 23.5 million populations. In the legislation process, they actually tie taxation with reserve. And so this is something we need to consider when we begin to devise taxation, because one of the policy issue in taxation is when should we increase tax? So in Taiwan's legislation, their tax increase is tied with reserve. And in the legislation, they include the national health insurance should always maintain between 1 month to 3 months expenditure as reserve. And so the taxation increase will happen when the reserve is below 1 month expenditure. Also, the taxation should be reduced if the reserve is exceeding 3 months. So that's just for your reference that in the near future, we need to discuss how we tie that with the change of taxation.
Thanks for that reminder, Chenwei. Now that's ringing a bell for me too. Jeff?
Yes, thank you. I think the comment earlier made by John about the OHSU legacy merger there's a very large number of moving pieces. Both parties are making promises about what would happen if the merger occurs, yet both are at this point, I believe, money-losing operations. We want to be very careful about making assumptions about grabbing, or for lack of a better word, the foundation assets, despite OHSU's promise of investing additional money into the resulting foundation from the merger of the two organizations. Just be careful on these assumptions because first, the merger may or may not occur, and secondly, despite both organizations' desire to have the merger, the best description I've seen about it is it's two drunks leaning on each other for support.
Jeff, if I could, I've
Please.
submitted a comment expressing those exact concerns. How can we be looking at a deal that's going to give away hundreds of millions of dollars when both of these organizations appear to be struggling? So, but I'm not that interested in what happens with the merger. I think we're learning a lot about the reserves and the processes around those reserves. And have to do our best to not be distracted by all the legacy OHSU, but be learners in terms of the information that's being made public and all.
That's quite a robust discussion to start us off. I wrote some notes. I'd like to move on to introducing our consultants. So I'm very pleased to welcome the Echo Northwest team, Morgan Shook and Andrew Dyke, and would invite you both to say a little bit more about yourselves. And you're welcome to opine on the previous topic if you choose.
I'll keep the meeting going here. We'll stick to the introductions, but as we're getting under speed. So we're under contract with the Universal Health Governing Board as of last week. And so we've been spending some time getting caught up on the materials. And so looking forward to assisting you all in this really important project. So just a quick introduction. Echo Northwest is a 50-year-old economics firm. We're based in Portland. I'm actually based up in our Seattle office. We work across the United States on a range of important public policy issues. My expertise is actually in tax policy, but I actually have a background in health policy research. Actually was a biochemist and worked in biotech, and then worked at the University of Chicago in health services for a number of years before joining my current position, ECHO. The thing I would point to here that we are trying to assist you with, particularly with respect to taxes and revenues, is some of my work I've done in Washington. I led a bicameral, bipartisan approach to look at tax structure reform in the state of Washington. So a 4-year process, working with both politicians and department staff to help understand the dynamics with respect to sort of tax policy and revenue generation. We are under contract to do a lot of that same work, but in this sort of health funding context. So happy to be working. So I'll let my colleague Andrew Dyke give a quick introduction as well.
Yep, thank you, Morgan. And like Morgan, I'm an economist at ECHO Northwest. I've been working with the firm for about 19 years. Before that, I worked for Oregon Public Health, and before that in graduate school, so I got my PhD in economics in North Carolina. Focus was on public finance and labor economics, but also supported the North Carolina Medicaid and TANF programs, maintain and analyze their administrative client level database. So familiar sort of with the state side of the data collections. And during my time at ECHO Northwest, have worked on projects for clients with a variety of different perspectives in the healthcare industry, from health insurance systems to hospital providers to analysis of healthcare policy for other entities. And so really looking forward to digging in with you all, and enjoyed the conversation so far.
Thank you, Morgan and Andrew. And I just want to reiterate, we're so happy to have you, and looking forward to working with you. So with that, I'm going to hand it over to Chenwei to walk through his presentation on the health systems financing. And I would say, and I hope this is okay, Chenwei, that if someone has a comment or question on a particular slide, they can just raise their hand and you can call on them. Is that okay? Or I'm happy to
Yes. Please interrupt me if you have questions or comments.
Yeah, thank you very much. So it's all yours.
Okay, good morning. This is the second time I'm presenting this. And actually I added 2 slides compared with the last time. So my today's short presentation, including 3 sections. The main section are in the part 2 and part 3. The first one, just very brief, introduce the nature of health system finance. Next, please. Next, please. So one of my mentor, Bob Evans, he succinctly summarized the 3 fundamental questions of health system finance. And he liked wordplay. So the 3 main questions is who pays, who gets, and who gets paid. So it related to financing and delivery and payment system. Next. So the nature of health system finance, according to the National Health Account literature, it examining into sources, contributing mechanisms, collecting agencies, and final destination of funds, how a society finances healthcare. Next. So this is a simplified version of National Health Account. And the 3 main systems within health financing system are financing source, which can, and again, what I listed is not a complete list, it's just a common list. So it including the source that mainly from individual, family, employee, employer, etc. And then the financing mechanism, that is what kind of taxes we are going to impose. And then the financing agency is regarding which agency we design to collect and distribute those funds. Next. And this is a summary of my advisor Bill Shaw's article about the importance of system finance. So it determined the risk pooling, the distribution of the cost burden and decision-making power, and determine resource allocation and how we distribute services, and finally also payment method. Next. So that's just a quick overview of health system finance. The main focus of this presentation is on on public finance part, because the national health insurance or single payer system, most of the time are financed through taxation. So you're most familiar with state involvement in health system finance, including market failure, externality, the human capital arguments, and I will come back to the very good arguments, and then also the ethical argument of healthcare as basic right, or more broadly, my other mentor, Gavin Moody, argue health system as a social institution. Next. And from from public finance and health system as a social institution's perspective, we can identify social function of public health system finance, including promoting health, which is often absent in the private finance health system. Likewise, equitable financial burden, equitable access to healthcare are also absent from the private finance. Income redistribution are also absent from private finance. And then there's a human capital argument. And also the final one, seldom being mentioned, Gavin Mooney argued, the longer, broader purpose is a better society. Next. And in the literature of public finance, there's one argument about communal interests that give rise to communal wants, and communal wants that stimulated the motivation, the purpose of public finance. Next. And the collective purchase of healthcare that embodied in public finance through taxation include, again, this is the argument made by Evans, public system embody public redistributional policies in a way which private insurance cannot. Also, public finance, public insurance serve as a collective purchasing agency for consumer or patients. Next. And this is a quick summary of sources of government revenue, tax, fee, public sector enterprise, which is seldom applied in the US. Of course, foreign aid is also not applied in the US, borrowing and money creations. And one argument some public economists argue is it doesn't matter what we label it, as long as it's mandatory and collected by the government, they are all taxes. Next. And likewise, here I summarize what are the options of public finance of national health systems, or in our case, the state single payer systems. And there's a general tax revenue, and then there's earmark tax. Some country label them as premium, they are still tax. And then there's a special tax, such as tobacco tax and other tax we are considering. Next. And of course, there's a public subsidy. And in the latest estimation, our public subsidy for private health insurance amount to about 1.3 trillion in 2023. And there are also fees, and I will skip the others that's generally not applied to us. Next. And I will briefly summarize the, according to Musgrave and Musgrave, 3 categories of goods, and that will have profound impact on our future decision on what shall we cover and what kind of tax or fees shall we charge. Most goods belong to private goods, and the 3 main characteristics: rival consumption, excludability. Rival consumption means one person's consumption exclude other person's consumption. Excludability is regarding whether it's feasible to charge fees and exclude non-payers. Non-externality means the consumption of which does not affect others. And most goods, services belong to this category. And in a market-oriented society, there's a very little debate about who should allocate it. We generally leave it to the free market. The government's role is to assure safety and to prevent monopoly. Next. The second category Musgrave and Musgrave categorized is merit goods. Similar with private good, it has rival consumption and excludability. The main difference is externality, meaning the consumption of which generate benefit beyond the consumer themselves. Classic example including education and healthcare, which is why most countries, including US, have public finance. The difference is to what degree it's public finance. Next. So before I continue, the merit good are the one at most contentious because it is feasible to be allocated by free market. At the same time, society need to ask, is the market allocation desirable? So that's why it's often subject to debate in a free market-oriented society. The last category, public goods, again, there's a seldom debate about public goods. It's unique in non-rival consumption and non-excludability. That's different from the other two types. Externality is the same as merit good. But for public goods, again, there's a seldom debate because free market is not able or not willing to allocate public goods. Next. So in this table, I summarize the characteristic of the three categories of goods in terms of rival consumption, in terms of excludability, in terms of externality. Next. And as we review why there are growing public share of health system financing, these are the key reasons: cost control and equity concern. Also, more integration of healthcare finance and health promotion, which private finance is incapable of doing. And then recognition of the limit of market in healthcare. Next. So this is the OECD comparison in terms of public versus private spending. And US is on the far left, and the red bar is the OECD average. And if you look at the US government or public spending, our public spending alone is actually higher than about nearly two-thirds of the OECD country, and higher than about half of the OECD's total, each country's total spending. Next. And then a brief introduction about the type of tax. The direct tax are those which are imposed initially, but the household or individual is meant to bear the burden. The burden of direct tax cannot be transferred. And the indirect tax are tax that imposed at some point, but of most of the time, the burden of indirect tax can be transferred. And sales tax, excise tax, VAT, and also the current contentious issue of tariff. These are all indirect tax. The burden can be easily transferred. Next. And in public finance, transfer payment by government are viewed as negative tax. So Social Security subsidy, and I will come back to Social Security later. Next. And a little bit more on taxation. In most middle and high income country, the personal income tax are the main source of government revenues. And the complication of personal income tax lies in balancing efficiency and equity. And therefore, the concern for equity inevitably increase the complexity of personal income tax, such as personal exemptions, deductions, what constitute tax-free income, and what will be the tax base, etc. Next. And deduction is a very complicated issue in personal income tax. And the concern generally focus on equity, but also on incentive aspects, because the society may view some goods, some services are desirable and want to encourage individuals to engage in those activities, and therefore through deductions to encourage those activities, such as donations. Next. Because of complexity of income tax, there were numerous times people proposed a simplified flat tax. And I remember this happened in the 90s. One of the presidential candidates actually proposed a flat tax. And since we are not considering flat tax, this is just for your information. There are still this argument how to make taxation simpler. Next. And then there are other taxes, such as tax on consumption and on sales, and special taxes and excise tax, such as hotel tax that most cities impose. And then the payroll tax. Many countries' universal health care either entirely or partially rely on payroll tax. But payroll tax put heavier burden on people with fixed income, and is create the issue of equity, because people who don't rely on fixed income, some of them are rather low income, but some of them are very high income. They rely on bonus, on stock, etc. And there's a property and estate tax. US and Canada are probably the only two high income countries heavily rely on property tax. And property tax also have equity concern, as it put little regard on ability to pay. And then there's inheritance tax, and poll tax is very regress. In modern days, only UK during the Prime Minister Major in the early 1990s tried to impose that, because it ignored ability to pay. I see a hand, Cheryl. Yes.
Sorry to interrupt you. I just wanted to, before you got off the slide, I wanted to ask you about value added tax. This is something that several of the committee members, including myself, are interested in exploring. And I don't remember if you go into it in more depth, but I'm just wondering, what do you think of a value added tax as an option? What's your opinion?
Okay, just a very quick comment on that. Value added tax is very common in European unions and in Canada too, but we haven't implemented yet. And President Clinton proposed that if his healthcare reform was implemented, he's going to finance it with value added tax. So there's one main concern about implementing value added tax at Oregon. That's the infrastructure. And so we have to weigh the cost versus benefit, particularly the administrative cost of implementing value added tax, because value added tax is imposed at every stage, from the raw material to the final product. Whenever a product, or from the original material, each stage when the market value improved, you added value added tax. So it's a levy in multiple stages. So this is a quick summary. And Richard, please.
I was just talking about the property tax. I mean, it's essentially a flat tax. We say that it's not progressive, but that wealthy people probably own more property and pay as a dollar amount way more tax than lower value properties, although the rate on the assessed value may be the same.
Yes.
So it has some, so wealthier states pay more, but so I consider more of a flat tax than a regressive tax, but then sales tax is flat, and it's also considered regressive. So that's all I'm bringing up.
Thank you. Well, the classic example was Vancouver, BC, that in the 1990s, there's a huge influx of people from Hong Kong bringing cash to buy homes. And in most homes in Vancouver, BC, within a matter of 5 years, the property value doubled or even tripled. And that lead to the long-term resident. Some of them, since their grandparents living in the same house, they were forced out because they cannot afford to pay the property tax. And so that's an issue because it did not consider people's ability to pay. And yes, you can make a fortune if you want to sell your home, but if you don't want to sell your home, you cannot afford to live it. Next, please. So the last section, I want to briefly talk about equity in financial burden of health care. Next. So the concept of horizontal equity and vertical equity was introduced by Musgrave and Musgrave. And this same concept in the 1980s was adopted in European Union to apply the same method, same concept to equity in healthcare. And so the horizontal equity, the simple definition is people in the same income status or ability to pay should bear the same burden of tax. And keep in mind, in public finance, when we talk about burden of tax, we are not talking about the nominal amount. We are talking about the rate, the tax rate. And so the horizontal equity means people with same income, their tax rate should be the same. Next. And vertical equity referring to people with higher income pay higher rate of tax, not just higher amount, but higher rate. And then in a narrow definition, so the progressive tax has two meaning, in the narrow meaning and then the broader meaning. The broader meaning is a matter of degree. The narrow meaning is within the vertical equity considerations, that if people with higher income pays higher rate than people with low income, that's considered progressive tax in the narrow definition. And so at the bottom, I show the example that people making 10,000 versus 20,000, and then the final tax rate. Next. And then within the context of vertical equity, the second type is called proportional tax. That means people in the middle, in the low income and high income pay the same rate, even though high income still pay more in nominal amount. But in terms of the rate, they are the same. So at the bottom, I show you the example. Next. And then the regressive tax, again, within the narrow sense, because in the broad usage, generally, we are talking about how progressive or how regressive are the tax. So in the broad definition of regressive versus progressive tax is referred to a degree, to a range. But within the vertical equity context, the regressive tax is simply people with high income ends up paying lower rate of tax. So below is the example. Even though the person making 10,000 and 20,000 pay the same amount of tax, but in terms of tax rate, the higher income people pays less. This is the narrow sense of regressive tax. Next. And tax incidence is the reduction of personal or corporate income caused by the imposition of a tax. And in public finance, only people, including stockholders, workers, landlords, consumers, etc., can be a tax. A corporation cannot, because the corporate tax can easily be transferred to the consumers. And in the end, the entire tax burden must be borne by individuals. Next. And there are economic instances ask the final burden of the tax. So the economic instance concern about the actual burden. Statutory instance only look at who pays tax, but keep in mind, some of the tax, particularly indirect tax, the burden are not borne by the person who pays or the entity who pays, because those burden can get transferred. And the final burden distribution may differ from that of statutory liability. Next. And in public finance, there are different views on distributive justice in terms of tax equity, such as endowment-based criteria or utilitarian criteria or egalitarian criteria. And then there can be a mix of any 2 or 3 of those criteria. But broadly speaking, there are 2 commonly applied principles in terms of tax equity. One is called benefit principle. The other is called ability to pay principle. Ability to pay principle focuses on the taxpayer's ability to pay, whereas benefit principle focusing on who benefit from the goods or services, and those who benefit from the good or services should contribute more. And in our government public finance, we actually have both. So for example, earlier I mentioned in public finance, any money government collect as mandatory are all different form of tax. They are all tax. They may be under different name. And so within our government, most fees government collected are following benefit principle, because the argument is for those fees such as applying for a passport, you pay $100, and low-income people don't use passport, generally don't use passport, so they don't have to finance the cost of issuing a passport. And if you can afford to travel overseas, then you can afford to pay that $100 fee. So some of the services in our government are following benefit principle. So this is when we considering what services should the universal healthcare coverage. That's when we consider whether we apply benefit principle or we should apply ability to pay principle. Next. And this is a chart showing the sales tax are generally very regressive. So on the far left, the people who are making at the bottom, making less than 18,000, these are the lowest 20%, the lowest quintile. On average, they contribute 4% of their income. And then this is exactly regressive. The higher income people, they end up paying far less in terms of percentage, not money. Next. And this is what I mentioned since the 1980s. A group of health economists has been tracking sometimes just European Union, sometimes OECD, that including Japan, Australia, and US, Canada, and tracking about their progressivities of healthcare finance, but also progressivity of their healthcare deliveries. And in this 1999 studies, they found in most countries under comparisons, the public finance part of the contribution are more progressive. Those below 0 are progressive, above 0 are regressive, and private finance generally are more regressive. Next. And this is a study done by my colleague in Taiwan, again, following quintile. And they calculate each quintile's per capita expenditure in healthcare annually and divided by each quintile per capita contribution in tax. And so this is the benefit to tax ratio. So the lowest quintile, you can see their benefit to tax ratio are about twice. Whereas the highest income at the bottom quintile, they're becoming more progressive to the extent by this is in a Taiwan's calendar year. The last one in this data is 2016. Yeah. By 2016, the benefit to tax ratio is roughly around 60%. So that shows the progressivity of Taiwan's national health insurance. Next. And in the public finance literature, there are some consensus about what considered good tax. And of course, people who are against tax will argue there's no such thing as good tax. So within public finance, these are some of the conditions for good tax. The revenue should be adequate. The distribution of burden should be equitable. And then the problem of incidence is make sure we know who are actually bear the burden, not necessarily the people who pay the tax bear the burden. And also minimize interference with economic decisions. Next. Tax also serve as important function for stabilization and growth objectives, but also permit fair and non-arbitrary administrations. And lastly, administration and compliance costs should be as low as possible. And this is my concern that if we are implementing VAT, we need to have an estimate of what will be the administrative cost because we didn't have that infrastructure yet. Next. And this is a new slide I added compared with the last one I presented at the board. Over the last more than a month, we have here mainly from the administration misinformation about contribution versus entitlement, particularly mislabeling Medicare and Social Security as entitlement. They are not entitlement. In public finance, there's a distinction between contribution and entitlement. Contribution are programs we pay to participate. Medicare and Social Security are contributions because those of us who receive payroll, we contribute to that. Whereas Medicaid are entitlement because receiver of Medicaid generally did not directly contribute, even though strictly speaking, it comes from our income tax. So indirectly we contribute, but here in the narrow sense, we're talking about whether there's a direct contribution or not. Yes, Richard, please.
Yeah, so on the issue of Medicare and Social Security being contributions versus entitlement, indeed, people have paid into Medicare and Social Security, but I think that they get out way, way, way more than they pay back. And if we look at the next 30 years of the federal deficit, I mean, we're talking $200 trillion, and most of that is in Medicare and Social Security because people are drawing out way more than they paid in. So I understand the difference between contribution and entitlement, but I'm thinking for many people, Medicare and Social Security are closer to entitlements and contributions because they get out so much more than they paid in. That's all.
Yes, but I don't have the statistics whether people get more than they pay in. Is an empirical questions. For example, for Medicare, there are people, beneficiaries who remain healthy and use very little health care. Therefore, they contribute more than they get. It's only the sick who ends up, but that's the same as insurance. Likewise, for Social Security, only people who live long enough may end up getting more than they pay into it. For people who live a short life, and some of them, they never get to benefit because they died before they are eligible for Social Security. Likewise, when we're talking about immigrants, and I don't have the count, but keep in mind, there are many immigrants who are here temporarily. They also pay into Medicare and Social Security, but never get to benefit from them. So this all depends on the life expectancy and also the health conditions. Thank you for your comment. Next. And here's a quote on the left from Friedrich Hegel's. What is rational is actual, and what is actual is rational. And my colleague Ted Mammert simplified that. Nothing that is regular is stupid. And Ted Mammert, together with Evans, used this quote to refer to why they are repeated advocate for cost sharing when the theoretical foundation of cost sharing has been dead for more than 3 decades, but they keep coming back. And Evans has a funny term to call that intellectual zombies, that they're intellectually dead but will not remain dead. Next. And here's another new slide I added from Evans about political economy or public versus private finance healthcare system. He said, relative to universal fully tax finance public insurance, an expansion of private payment would thus enable the wealthy to pay less and get more. Conversely, for those with low income. And this conflict of economic interest is real, unavoidable, and permanent in all systems. Next. So this is my last slide. Got the inspiration from Evans' quote. I created this chart comparing public finance versus private finance. So both have two functions of income redistribution. Both redistribute income from healthy to the unhealthy, and also from consumer or citizen to the providers. But only public finance can serve the function of redistributing income from high income to low income. That concludes my presentation, and let's open up for comment and discussion.
Thanks, Chenwei. This is a really good foundation for our discussions and recommendations for the tax structure for the health plan. So I really appreciate you going through this again. For those of you, whether this is the second time that you have heard this presentation or your first time, did anything come up for you as you were listening to the presentation? Any insights or questions, comments? Well, I can start. I do have one thing that's kind of nagging at me, and I just want to put it out into the ether. And so that is, with the current administration's attempt to further privatize Medicaid and Medicare, will this impact our calculations at all, or we just put, or the waiver process for that matter, just put it aside? Because some of the things we've been hearing are potential, well, very big cuts in Medicaid for one, huge cuts. Number two, there might be per capita caps, or there may be block granting of Medicaid, just like some of our mental health and substance use funds are block granted through SAMHSA. So I'm just wondering if anything that's going on currently with the federal administration will impact our calculations here in this committee or the waivers for the operations committee. That's my general question. Thanks.
Yeah, let me just very briefly, I don't have the full answer to that, but briefly respond to your question. Yes, I have that concern in my mind. And I forgot whether I mentioned that in our last finance committee or in our last board meeting, I mentioned that in terms of our revenue generation, we need to have a contingency in terms of, because in our original estimation, we are relying on the Medicaid federal contributions. But what if the federal contribution would dramatically cut? How do we make up the difference? So that's the contingency that we need to be prepared. Thank you, Cheryl. And then John, please.
Yeah, I know as I looked at the slides before the presentation and listened, you know, I do come back to we do have three revenue streams that are very different. Medicaid is an entitlement. That's probably not going to change. We're going to have a relationship with the federal government around that entitlement. While Medicare, I really agree that it's more like I paid into this. It's a contribution. It's a premium, and you know, I'm doing my taxes, and you know, it's interesting that under some circumstances, one of my friends who unfortunately is quite ill has very substantial healthcare deductions, very substantial. tens of thousands of dollars of impact on his taxes. And so, it makes me come back to thinking about, should we really think about revenue in kind of three compartments? We have a system for Medicaid. We're already financing it. We're already paying most, but not all the taxes because of the provider tax. And we've had a little bit of discussion about the provider tax and whether that would continue. And I think decided, no, that doesn't make sense in our scheme. But, the revenue, there's a revenue system for that exists. And in Medicare, there is a revenue system that exists. It is based on contributions that Medicare patients have made in the past, and albeit there's some very substantial federal contributions to that. But do we focus on Medicare separately? You're dealing with the people over 65 are the wealthiest segment of the American population. And they're also the folks who are actively using the healthcare system. So it's really important to them. And do we focus on that differently, kind of with more of a premium approach in mind? And we look at what would the tax implications be for lower and mid-income people if that clearly came across as a premium that could be deducted. And then the third, and that's going to be the most tricky part, because those are definitely going to be new taxes on working people who will need to be convinced it's the right thing for them. But if you just focus on them as a separate mechanism, does that make it more equitable, more fair, more easy to understand? Anyway, it certainly prompted me to be thinking along those kinds of lines.
Thank you. And I think that's called for further discussion. And let me just make very brief comment responding to your question about Medicare. I think how we treat Medicare personally under universal health system, all people should be treated equal, but with a caveat that is whether we get a waiver from the federal government, and that may affect how we fine tune with the Medicare recipients. Thank you for your comment, John. And then Charlie, please.
So I have a number of comments. One of them relates to what Cheryl asked about, and I would say that pretty much we have no idea whatsoever what effect changes in Medicaid or Medicare will do to what we want to do. And we probably will not know that for a while. And even if we do, we are going to be pretty much completely shooting in the dark about what's going to happen at a time when we could do this kind of system we might want. So we're going to have to just, we have no idea. And I would say that, and so all the calculations that I've done, for example, about what expenditures have been historically and where contributions came from are of not much use going into the future. I don't know what we can do with that. Regarding waivers, we can be pretty sure that there's no way that we would ever get a waiver for the kind of things we would want to do with the current administration. And what would happen after that is going to be completely a guess. We have no idea whatsoever, and we're going to have to make recommendations in 2026. The governance board will, and they will have no idea what's going to happen. And so at some point, we're going to have to make a decision about, well, what do we do with this? What do we do with this total uncertainty? And what should we do going forward? And I don't think we can have enough contingency plans to deal with all the various possibilities. So there's going to be some real tough discussions about that at some point. And again, we're just learning what some of the issues might be. And as far as, I mean, there's another meaning for entitlement, and that is something to which you're actually entitled to legally. And so in that sense, Medicare and Social Security are definitely entitlements. And that's a good thing because we're entitled to them and we should get them. And I would say Medicaid is also in that category of you are, and of course, the legal definitions of what you're entitled to can change, and we might not want them to. So anyway, I'll stop there.
Thank you. Thank you for your comments. And again, this is something we, as a committee and the board, will need to take into account. And for the time being, the only idea I have is we might prepare just one contingency plan for the worst case scenario. What if we receive no federal funding for Medicaid? And that's the worst case scenario. And we don't need to prepare multiple one, maybe just prepare one. Thank you for your comment. And then Jeff?
Yes, thank you. And I want to reinforce the comments from Charlie. Even in the best of circumstances, getting a waiver for Medicare and Medicaid, without that, everything we do falls apart. And I could also very easily envision this administration or the next administration and the next Congress saying, well, we'll give you a waiver, but we're going to cut the money in half that we would otherwise might have been there. So just to reinforce that, without a waiver, regardless of administration, what we have, I don't think becomes tenable. But I also agree with the comment that was just that you just made about we should present a worst case scenario in terms of what it means for funding, along with the base case. Thank you.
Thank you for your comment, Jeff. I agree. And Oregon had that experience in the late 1980s to early 90s when we presented OHP. The Bush administrations each year denied our request for waiver until President Clinton came on board, finally granted our waiver. So that delayed our implementation for about 3 to 4 years. And this is something we may expect. We may be prepared. Charlie.
So I have another comment that I'd forgotten about, and that relates to something that John had said. And one thing we need to remember is for Medicare, there's also a relatively substantial population of those under 65 who qualify primarily because of disabilities or a particular illness. And rather than being among the most wealthy, those are among the poorest. And some of them are not quite poor enough to qualify for Medicaid. So that's another population of the Medicare group that we need to make sure we're thinking about when we figure out how to deal with what might be fair. So it's a pretty decent sized number. It's not minuscule. So thanks.
Yes, I also want to make, thank you for your comment. I also want to make a quick comment about, particularly about Medicare, that how some people receive more than they pay into it. That's the nature of things in pooling risk. It happens in private insurance that many of us who are healthy, we pay way more than we receive, whereas people who are ill, they receive way more than they pay into it. So that's the nature of pooling. Thank you very much for your comments.
Thanks so much, Chenwei. This is a really great discussion and brought up some new things that we need to contend with. I believe we have a break factored in now. I'm okay whether we take a break or not. I don't know if well, we'll just do it. Let's reconvene at 10:15 because it's in there. So we'll see you in about 10 minutes. Hi, everyone. Welcome back. I think Kim is here. Let me look. There you are. Hi, Kim. We're going to hand it over to Kim now to get us started on tax structure considerations. So take it away, Kim. Thank you.
Thanks, Cheryl. Hopefully everyone can hear me. Good morning. Thanks for that nod, Cheryl. I'm Kim Yee. I'm temporarily working as the Senior Policy Advisor for the UHP project. Today, I'm going to give a short presentation to queue up a discussion about tax considerations for the UHP that naturally transitions from Dr. Chi's presentation and the discussion you've already had today. As background, recently Cheryl solicited input about tax considerations from this committee. Thanks to everyone who participated and provided feedback. Charlie Swanson actually prepared a short report that Katie was able to append to this meeting. So I encourage everyone to read that if you get the chance, when you get the chance. For this particular presentation, I worked with the UHPGB staff, OHA policy analysts, and our consultants, Anya Rader-Wallach and Janine Smith at HMA to develop this presentation, and it draws in part on Charlie's report as well as ongoing committee discussion. Next slide, please, Katie. Thank you. So here's an overview of what I'll cover today, and this short presentation is going to be followed by an overall committee discussion of tax considerations. Now that Eco Northwest has joined to offer their knowledge and expertise, I recommend that this committee focus their discussion on considerations that might guide Eco Northwest's work, because specifically as part of their contract with us, Eco Northwest will be providing taxation and revenue expertise. So 1, taxation and revenue expertise to this committee. 2, identify potential taxation and revenue sources and a financing structure for the UHP. And 3, they're going to model the estimated tax incidence for different revenue options. So I'll repeat this at the end of the discussion so you don't have to hold it in your brains. Okay, next slide, please, Katie. Thank you. So the UHPGB staff, OHA policy analysts, consultants at HMA, we looked through all the documentation from this committee and we identified terms that might benefit from a standardized definition. So we listed those terms here. I'm just going to read the terms, not the definitions. You all have access to these slides in this presentation. So we defined corporate activities tax, corporate income tax, double taxation, the FICA tax, payroll tax, progressive tax, sales tax, sin tax, the tax cliff, taxable income, and the value added tax, or VAT. Next slide, please. So referring back to Charlie's report, Charlie provided a really thoughtful report that incorporated many discussion points that this committee has raised. And this figure shows how the principles in the tax, I'm calling Charlie's report the tax considerations document. So this figure shows how the principles from the tax considerations document overlap with the Finance and Revenue Committee's guiding principles, which is in your charter. So we can see overlap in the middle in principles related to, say, the legislative mandate, such as drawing from a dedicated trust fund, as well as other equity-related considerations that the committee has identified, so progressive and limiting movement, avoiding cliffs. And as the discussion on the tax structure considerations evolves, the committee can continue to decide how to incorporate other principles, so ones that are specific to, say, what Charlie has provided to us, or specific to the committee's guiding principles. I could see principles such as easy to understand, stable, predictable, scalable, adequate. Those are all just really important principles to us for us to think about. Next slide, please, Katie. So the recap of the Joint Task Force report funding recommendations is reproduced here from work that HMA previously performed. I think Anya Rader-Wallach from HMA is on this call, so hi, Anya. And the recommendations included both a payroll tax and a healthcare income tax that loosely began considering this idea of what should the specific tax base be. So for example, incomes at a specific FPL. Next slide, please. Thank you, Katie. So the next two slides are just going to provide a high-level summary of tax structures that this committee has already discussed. We don't need to read them in full, but I will pause to give you all a couple minutes to browse this on your own. The three main tax structures that I've listed here are the employer payroll tax, the personal income tax, and the corporate income tax. And then in the columns, we have some summarized considerations that this committee has already brought up, as well as advantages and disadvantages of each of these tax types. So for example, for the personal income tax, this committee has given a lot of thought to what the income tax base is going to be. Should it be based on an FPL? Should it, so that it's sort of consistent with the way that Medicaid and other means-based public insurance works, or should it be progressive? So there are lots of ideas about what the income tax base should be. Okay, I'm just going to be quiet for a minute so folks can digest this slide as they need. Okay, and then Katie, next slide, please. This is my last slide, which is just going to summarize and compare the some additional tax structures, so sales tax, value added tax. But if we recall from Dr. Chi's presentation, there are so many other taxes we could be considering, such as an inheritance tax, excise tax. And so as you want, you can revisit Dr. Chi's presentation, revisit what's written on these slides, revisit your personal notes. And with that, I would like to move us into the committee discussion. I wanted to just be very brief with this presentation. So again, as we move into this committee discussion, I would like to encourage folks to think about how your discussion can inform Eco Northwest's work, because John, I see your hands up. Dr. Chi, I see your hands up. I'm not leading this discussion, Cheryl is, but I'm just going to remind us that related to tax considerations, Eco Northwest is going to be providing taxation and revenue expertise to this committee, identifying potential taxation and revenue sources and a financing structure for the UHP, and modeling the estimated tax incidence for different revenue options in addition to other services. Thank you. And Cheryl, I'm going to give it back to you.
Thanks, Kim. And I would welcome you to jump in though, because you're going to know answers and have context that I don't. So I will certainly facilitate the discussion. John, we'll start with you.
Yeah, again, I hate to be Medicare focused, but Medicare is individual insurance. So the one statement on a slide talked about employers and households. Sorry, I think the word individual needs to be there. I pay Part B individually, okay? The 770 task force spent significant time looking at, well, what should happen with the Part B premium payments? And their decision was all Oregonians on Medicare who want to be in this plan will have to pay their Part B premiums. And there are a significant number of Medicare folks in Oregon, as Charlie mentioned earlier, whose income is such that they don't. They can't afford to pay Part B premiums. And I think the task force talked about, well, you know, we'd have to develop a subsidy for them and identify them and help them out. But in Medicare, I think it's going to be very difficult to depart from that individual relationship, paying an individual premium. You know, we talked at the task force about we would be foolish to tell the federal government, well, just take all Oregonians who are 65 and over off Medicare and we'll collect the money. No, we want to do the exact opposite. When somebody enrolls and they pay their Part B and probably their Part D premium, let us know, because they will be enrolled then in our plan. So I think for Medicare, it's going to be hard to shake that individual relationship. And that was $1 billion. And it's $1 billion in those Part B premiums. That significantly helped the task force get the spreadsheet to where they got it. And it's not a tax, it's a premium payment. And I'm going to keep arguing, I think, that we need to look at Medicare differently. Because those of us who are in it feel like we are paying, albeit maybe not a huge percent, but a significant amount of money towards that, and we need to keep that in mind.
Hey, John, I'm probably kind of dense about Medicare. I'm not in it yet, and Medicare doesn't pay for a whole lot of services in the public behavioral health system. So can you say more about like how we address Medicare differently? I don't think I'm tracking what you're asking.
Well, I mean, when you turn 65, you enroll in Medicare.
Mm-hmm.
And essentially you leave either your individual insurance or your group insurance, and you
Right.
now relate to Medicare as one person. I mean, I don't enroll with my wife.
Mm-hmm.
We're two separate individuals, both responsible for indicating to Social Security that they should pay our Part B premiums and our Part D premiums. And so we are individuals who are responsible for paying our way on Medicare. And if we stopped doing it, there would be consequences.
Mm-hmm.
Does that help?
I think so. I mean, I know how Medicare works, but I just was wondering how this factors into the tax structure discussions. I'm just trying to understand how we would address it differently.
Well, I'm arguing that I know some people would say, well, a premium is a tax. But when it comes to Medicare, where individuals have paid premiums since the start of the program, I think we should do some consideration about looking at Medicare as a separate funding stream, and looking at, essentially we're adding some additional benefits. We're adding dental, vision, et cetera, just like Medicare Advantage has done. We're getting rid of co-payments and deductibles, just like Medicare and even supplementals do. Would it be wise in terms of communication and working with people over 65 to be able to say, you're going to be paying your cohort's way, and you're going to do so through a premium you would pay, just like is being done now really for Medicare Advantage. There'll be an additional premium that the single payer, if you will expect to be paid once you enroll and you pay your Part B and D premiums.
Okay, thanks, John. And before we move to Chenwei, Kim or Jenny, did you have any thoughts about John's recommendation?
Thanks, Cheryl. No, I'm trying to just, I think, as the questions that you were asking, Cheryl, I'm trying to understand. I think and John, correct me if I'm wrong here. When the task force made their recommendations, they said that Medicare would remain and something that people could enroll in, and that they would still have the option for Medicare. And what you're pointing out is that individuals who are in Medicare, and I stress the word individuals as you did, who are in Medicare continue to pay a premium for those Part D and Part B services. And are you advocating that the universal health plan or recommending that the universal health plan incorporate those services so individuals in Medicare wouldn't have to pay Part B and D? Or are you recommending that or advocating for the universal health plan to try to capture that Medicare dollars in order to support those individuals?
Now, I believe what the task force recommended was that Medicare folks who wanted to enroll in the universal health plan would be expected to enroll in Medicare and to pay their Part B and D premiums through Medicare. And that would then make them eligible to be in the universal health plan. And that an additional premium / tax would be charged to them in order to pay for the additional benefits that they would have: dental, vision, hearing, cost sharing eliminated, et cetera, et cetera.
And so are you agreeing with that recommendation, or you think that we should be considering something separate?
No, I'm agreeing with that recommendation. And I'm pointing out that if you follow the task force recommendation, that's essentially $1 billion or more of premiums that will be needed. Since I've paid those premiums for 10 years, I will always say, oh, okay, I'll keep continuing to pay those premiums. A low income person who has never paid their Part B may go, well, wait a minute. It sounds like this is a new tax for me because you're telling me I have to pay my Part B premiums. And so the answer is, well, if you want to call it a tax, yes, it's an additional tax. You follow me?
Yes. Yes.
Yeah, I think that's making more sense to me too. Thanks,
Yeah,
John.
I mean, if you follow the task force, whether you like it or not, Part B premiums and Part D premiums are required so that it is a quote tax.
Mhm.
It is revenue comes via the federal government, but the services are provided through the single payer.
Okay, thanks, John. Thanks for clarifying more.
Yeah.
Chenwei.
Yes, before I ask my comment, let me just quickly comment on John's questions. I remember one of our previous board meeting, we touched on this issue. At that time, the board come to a near consensus that actually what John is suggested, that for Medicare recipients, we will have a different financing or taxation plan, mainly focusing on their Part B and Part D contributions. So that was discussed previously in the board, but again, we haven't come to the conclusion yet, but we may continue to discuss that. And then I have a different comment and question that may require our committee to further discussion. This comment came from this term. I'm teaching a graduate course on health system finance, and the term project I have the PhD student done is one of the assignments is ask them to participate either online or in person, at least one of our meetings. And then the term project is for them to develop a financing plan for Oregon Universal Health Plan. So this week I was listening to their presentations, and this idea came to me because one group talked about the small business exemption. And then it just popped up my mind that the small business exemption doesn't make sense and no need under the Universal Health Plan. The only reason we exempt small business is under a private insurance. Their risk pool is so small, it's difficult for them to purchase health insurance. That's the main reason they're exempt. But this reason no longer exists under Universal Health Plan. And so the committee may want to consider, rather than exempt small business, what we might want to exempt are the business whose revenue is so small. It's not by size of the employee. The size of employee under universal health plan doesn't matter. That reason no longer exists. Besides, there are a lot of small consulting firms that generate massive revenues, and those consultants make a huge incomes, and it doesn't make sense to exempt them from the corporate or income tax. So this may need the committee to further discussion.
Thanks, Chenwei. Charlie?
So I'm going to respond first to some of what John said, that regarding the Medicare Part B premiums. In my mind, of course, Medicare eligible people should continue to pay that. The only question would be, to me, is should the Universal Health Plan in Oregon do something to reimburse those people? And further, right now, Medicaid pays Part B premiums for those who are eligible for Medicaid and Medicare. I mean, if they're dual eligible, the Medicaid pays those premiums for them. And I don't think we could possibly get a federal waiver unless our program also paid for them. So, I mean, I think that's just a given that it's going to happen. We are going to be paying those premiums for those who are Medicaid eligible, and maybe for more. I mean, that's a question we could think about. Another comment related to Medicare in general is the bigger question in my mind is, what do we do with the fact that Social Security income is not eligible, well, is prohibited from being taxed, or I guess is not taxed for Oregon income tax. And actually, I should go back to the Medicare part. I would disagree a little bit with what John said, that we're asking Medicare people to pay because they're getting extra services. The premiums only pay about 15% of what Medicare pays out. Almost all of what Medicare pays out comes from the general fund. So the premiums are not a big portion of what the federal government sends to Oregon to pay for Medicare patients' healthcare costs. So in my mind, I want to sort of go back to what I had talked about in my proposal, that almost all of the taxes we raise, in my mind, should come from essentially income tax, but a lot of that income tax should actually come from a payroll tax on employers. And the reason I frame it that way is because I think, and I described why I framed it that way in what I wrote. If you don't give a credit for the payroll tax that an employer pays on behalf of an employee, then you are double taxing those wages. Going back to the incidence question that Chenwei brought up, who's actually responsible, or ultimately responsible for the costs. So essentially, income tax with a payroll tax that is gives a credit for whatever is paid by the employer. And the other part of that is it does not create a burden on a small employer. You could say that they don't. There's all sorts of ways you could do it. To say there's no burden on a small employer, it's all on the employee at that point. But you could say, well, the employer could pay it. So I think that to me, that's where most of the revenue should come from. And then I would say that there's other things that could come into play. And to me, the most likely other place where we might get some taxes is from a corporate income tax. And I don't think you can get very much, but I think it would help. There's a problem with that. And that is that the corporate income tax is actually only a one-factor tax in Oregon now. It used to be a three-factor tax, and that one factor is just sales in Oregon. So there's lots of big companies in Oregon that pay almost no corporate income tax, and they probably should pay more, and we would like to get more. I don't know how you deal with that. But in general, I really go back to the notion that most of it should come from individual income tax with an employer payroll tax that mimics, on average, what employers pay for healthcare for their employees currently. And I do think there's a question about what do you do about Medicare and Social Security income not being taxable? And I'm not quite sure how we deal with that, but one of the ways we could deal with that is don't pay the Medicare Part B premium, but that only deals with it a little bit. So I guess I'll stop there.
Thanks, Charlie. Jeff?
Yes, thank you. I'd like to hear from our guests with Eco Northwest if they agree with Charlie's recent comment in his last comments now, that the payroll tax is the means by which the savings that companies have from not having to pay healthcare premiums anymore, is that the vehicle they envision to provide one of the funding streams for the universal healthcare coverage?
Yeah, putting
so-
our consultants on the spot here. Yeah.
Yeah,
Would either be care to
Jeff, I'm going to
respond?
give you a diplomatic answer to that in the sense.
I don't want a diplomatic answer. I want a straightforward answer.
Yeah, for sure. But I'll say our role is not to be making recommendations. Our role is to support you in answering questions and to bring you.
This was not my question is not a recommendation.
Yeah.
My question is the comment made by Charlie that the increase in the payroll tax accurately describes the means by which we would capture the money that companies are no longer paying for healthcare? That's strictly a factual question, not an opinion.
I was going to get to the answer there. You got to give me a
Okay.
second. Yeah.
I apologize if I'm being straightforward, but
Just give me a second. So
Okay.
if I understand Charlie's assertion here, and remember, we're getting up to speed on all this stuff. And so Charlie is suggesting that a payroll tax to replace the current employer contributions is the vehicle that he's recommending, right? So the money in the system right now is basically all the employer contributions to private plans, and the way to sort of not double count that or to sort of expand that level of contribution is to use a tax, in this case, the payroll tax. Am I understanding that right, Charlie?
Yeah, I mean, basically, the payroll tax, in my mind, should be of a size that, on average, would raise about as much money as as employers are currently paying for their employee health insurance. And the reason I say about that same amount of money is it's not, you're not going to match it because employers pay all sorts of different. You're just going to do it based upon payroll or, but the other thing to keep in mind is the tax expenditure, federal government tax expenditure, which we want to preserve. One of the ways to preserve it is to have the employers pay a tax. And if they do not pay that, then Oregon's economy loses all that money. And that's a substantial amount. I think it was around 4 billion or so each year. So we need to try to preserve that tax expenditure. And one way to do that, and probably the best way to do it in my mind, is the employer payroll tax.
Yeah.
So.
And Jeff, remind me again what exactly your specific comment there was with Charlie's point. I don't disagree with what Charlie articulated there. I'll withhold whether it's the best way, but because we haven't looked at it, not because Charlie's wrong, but I mean.
it was, my question was, is it, if you will, factually accurate? And in fact, when I say factually accurate, I mean vaguely right versus precisely wrong. That the payroll tax will be the substitute for revenue coming in to the revenue to come in that offsets the companies what they're paying in total for healthcare payments now. Acknowledging, as Charlie said, different companies have different programs, but in total, the payroll tax is increase in the payroll tax is envisioned to be approximately equal to of the money that companies are currently paying in healthcare premiums for their employees.
Yeah, so I would say broadly that sounds about right. We haven't sort of tested that independently, but I don't see anything why, outside of whatever might be legal in this case,
of course,
to sort of approximate. So basically, to swap out sort of the cost of that vis-a-vis, instead of contributions to plans, to a tax instead.
Okay, thank you.
Thanks, Morgan. Before I call on John and Jenny, I did see Janine's hand up a while ago, and I just wanted to check in with you, Janine, if you wanted to add anything to this discussion. It may have been an answer to the Medicare question a long time ago.
I was just gonna ask a different way to try to understand John's, how the Medicare discussion would fold into how you would handle those eligible for Medicare in these other taxes. So, but we got where we needed to get to.
Okay. Did you want to opine on anything else that we've been talking about?
I'll hold on opining for the moment.
I've been with a lot of lawyers lately, so I've picked up that verb. And then one last thing I wanted to do was just check in with Bethany. I see that you're with us, and if there's anything you'd like to ask or you'd like to comment on in this discussion.
No, I'm good. I promise I'll raise my hand if I have something.
Okay, all right.
Thank you.
Thanks, Bethany. Okay, now we'll go back to John.
Hopefully this will help. So I'm an employer, and I support this concept. And I agree in general with what Charlie has said. Okay, I'm willing to sit down and negotiate an employer payroll contribution around healthcare. Oh, and by the way, I'm very pleased that you're normalizing contributions or normalizing payments to the delivery system. So the healthcare costs for employers are going to go down substantially, and you're taking that into consideration, right? But I'm also hearing that you're going to subsidize Medicare. And now that bothers me, because there's already a mechanism to pay for Medicare, and that's through an individual payroll deduction that Americans have been making for decades towards Medicare, because Medicare is based on individual contributions. Okay, are you following me? And again, it's an example of, I think, and then you can imagine that employers will say, now, wait a minute. It sounds like you're going to potentially be subsidizing Medicaid with this payroll tax. Well, wait a minute, I'm bothered by that. I'm willing to talk about this as a payment mechanism for my employees in a new and less expensive and fairer system. But I'm bothered by the chance that I could be subsidizing Medicare. I've never done that as an employer, or Medicaid through this process. Think on that.
Thanks, John. Charlie?
I mean, I want to say a couple things related to what John just said, and go back to something earlier, but it's all related to Medicare. So I can understand where that employer might be coming from in saying those kinds of things, but the fact is they are already subsidizing Medicare and Medicaid. Again, almost all of Medicare money comes from the general fund, and all of Medicaid does come from the general fund. And so the fact that they're paying corporate income taxes, and the fact that their employees and them are paying personal income taxes, federal taxes, says they're already doing that. But an important point to me is that going back to what the task force recommended, they sort of recommended three things for Medicare. And to me, one of them is totally unacceptable. And that's almost what I hear John sort of saying now. So among the biggest problems with Medicare and Medicaid that I think we are trying to fix is that providers get paid much less than they do when they're treating somebody with private insurance. And if we do not fix that, I would have a real tough time going along with a universal plan. I mean, that to me is one of the basic equity things that we absolutely need to do. And one of the proposals that the task force made for dealing with Medicare was as the universal health plan was wraparound insurance, which would not allow Medicare providers providing for Medicare eligible people to get paid as much as they do for others. And so to me, that's an unacceptable way to deal with it. We have to get pay equity to providers in a system that we recommend for equity purposes. And that's just, to me, sort of fundamental. And we almost surely need to get a Medicare waiver in order to do that. And as I mentioned earlier, and Jeff agreed with, that we're gonna have real trouble if we can't get those waivers. And I don't think we want to go forward with something if we can't. And we need to get some way to deal with that. So I'll stop there.
Thanks, Charlie.
Yeah, Charlie, I would just say I am totally in agreement with you about the importance of normalization, and it should be across the board. And I'm not sure, maybe you and I should talk. I'm not sure I understand that conflict that you've described. And if it results in an exception in terms of normalization, I would absolutely agree with you. You got to get rid of it. Because you know, the system we have now so supports organizations positioning themselves in ways to get the best paying patients, and we just have to stop that. So I'd love to learn more about the task force decision you thought ran counter to normalization, because there's nobody who thinks that that's more important than I think. What I'm trying to point out is that, you know, I think it would be reasonable to have a payroll tax for individuals for Medicare. It would be small, but it would mean that, you know, from the start of people's employment, they were contributing to Medicare in anticipation of eventually having access to it. And that would come as an individual payroll tax contribution by individuals. So.
Thanks, John. And I just wanted to note that for the public behavioral health system, Medicaid is a better payer than commercial insurance by far. Just wanted to say that again. Richard.
Say, John, if I were with that employer that you're meeting with, in addition to taxes, I would say you're already subsidizing Medicare and Medicaid patients because your commercial premiums are way higher than they would otherwise be if Medicare and Medicaid pay their way. So this idea that they're not paying for Medicare and Medicaid, I know economists say that there's not cost shifting. And I respect economists. We have many of them on the call right now. But if you talk to any hospital, and you're seeing it play out right now with the Hospital Association of Oregon and taxes and negotiations with commercial insurance, is basically, if they don't get paid by Medicare and Medicaid, they're raising commercial rates. And so employers are already paying that, and we're going to save them money only in the sense that administratively it'll cost less. But they're already paying for Medicare and Medicaid. We're just doing it in a more just and a lower administrative rate. Over.
Yeah, I mean, Richard, I would counter that with, well, just because these cost shift mechanisms have become established doesn't mean you should add to them and make it worse. And as an employer, I think I would come in saying, I'm willing to sit down with you and calculate a payroll tax contribution that we would make, but it's going to have to be corrected for normalization. It's going to have to be corrected for the administrative expenses that you're going to get rid of. And in fairness, folks should contribute something on their own, and they could do that through the Medicare mechanism as individuals. You know, I mean, realize, I think you would be showing individual employers a very impressive number compared to what they're likely paying today. And realize some of them, of course, are going to go in and say, well, now you realize that my employees are actually paying 40% of the cost now. Are you going to pay those, or where is that in terms of this negotiation? I mean, some employers will say, okay, we're paying 100% or we're paying 90%, but some are going to be at 40, 50, 30. So anyway, just thinking about that negotiation, there's a lot of pluses in what we're doing that I think will bring employers to the table. And I don't want to complicate this more, but you know, the task force got to the point on ERISA that their sense was we've got to have a package that self-insured employers will want to join this. We're not going to be able to force them. You're not going to be able to force them to join, but you can make it so advantageous that they will do so.
Thanks, John. Charlie?
So I'm going to counter a little bit what John said, that to me, the individuals will be paying because they're going to be paying an income tax. And so individuals will be paying. And I also say that there's negotiations with the private companies that are not going to come individually. It's going to be in general, can we get voters to accept the tax structure we want? We're not going to go to each company individually and say, well, this is what your tax is going to be. This is what your tax is going to be. It's going to be the tax. And it's going to be based upon some figure, hopefully related to payroll. And if it is not close to the size of what they're on average currently paying now, Oregon economy is going to lose money to the federal government. And so that's my point about that. That's the only real reason for having the payroll tax. Otherwise, we might as well just do it all with a personal income tax. But the payroll tax allows us to preserve that federal tax expenditure. And that's why it's important to do so. And to the extent that they get a break, that on average companies pay less, we lose that money from the Oregon economy. Now, it probably should be a little less, but it shouldn't be very much less, or again, we lose that money. So I'll stop there.
Thanks, Charlie. Richard?
The other comment I wanted to make was about John's comment about Medicare premiums. Medicare is complicated, and you're paying premiums. We need to look at Medicare premiums, what goes to the federal government and is required, and what Medicare premiums go to a private company for Medicare Advantage or Medicare Supplement. So, and they're two different streams, but the one to the federal government is strongly progressive and is absolutely required. And I don't think that Medicare is going to allow us to get away by not having those premiums, because that goes to the federal government and we cannot interdict that. So I think when we talk about Medicare premiums, it's got to be very clear whether we're talking about Medicare premiums to private companies for either Medicare Advantage or Medicare Supplement, or whether we're talking about the mandatory Medicare premiums that go to the federal government that you can take it out of your Social Security and that are strongly progressive, and they're not going away, I don't believe. Over.
That's a good point. I hadn't even thought of that before. Thanks, Richard. So before we move on, I know Chunwei has his hand up and Charlie does too. Kim, just a process question. So do we then move to questions, discussion topics, topic ideas that we have for the consultants after we're finished with this discussion, or what would be the next step to kind of round out this particular part of the discussion?
Thanks, Cheryl. I think, well, hopefully Eco Northwest got a lot out of it. I actually wanted to return to a comment that Dr. Chi made about small business taxes. And I like that because it tied into this very Oregon concept of the corporate activities tax rather than just, the size of the business. So I think that there was actually a lot in this discussion that can help inform Morgan and Andrew's work, Eco Northwest's work. I
Okay,
think we're staying on time, so, you know,
yeah, is it,
the discussion, yeah.
is it
Good.
something that we should kind of review some of the questions that came up or some of the concerns or considerations? Would you like to do that at the end after I call on Chenwei one more time? Or how do you want to approach that?
I actually think that it might help for a future Finance and Revenue Committee meeting to understand the specific work that Eco Northwest is going to do. And so that'll come after the kickoff meeting. That way the Finance and Revenue Committee knows, you know, what the scope.
Okay,
of
okay.
Yeah, thank
Right.
you.
So we'll move to Chenwei, please.
Thank you. Actually, mine is a question for the Econ Northwest related to what we just discussed about the corporate payroll tax. So my question for the Econ Northwest is politically, when we implement this universal health plan, we want to face the least resistance from employer, from corporation. And so the question for you is maybe in the near future, help us to analyze and devise a way in which our corporate income tax will be neutral to what they are already paying for employee health insurance. So that's a task I'm kind of asking for the Econ Northwest to analyze.
I'll say yes. That's a great question. I think that's one that's broadly within our scope, Kim. So.
Thank you very much, Morgan. Charlie.
So there's a number of other questions that I think we need to deal with, and I'm not quite sure when or how we should. But you know, going back to the employer payroll tax, one of the things that's often talked about that Chunwei brought up is, well, there's a reason why small companies don't pay it now, and that's the small risk pool. But there might be a reason to continue them not paying it, and that would be just sort of maintaining that notion or maintaining stability, I guess, of where money comes from now, so that there's at least a choice for small employers to not pay that payroll tax and to continue just paying their employees. And so that's kind of why I had suggested this sort of scheme of that you could have marginal rates with tax brackets for the payroll tax, and it's based upon the total payroll of that particular entity that's paying that tax. And they could choose to pay more, but they wouldn't have to. And that also gives a possibility of employers wanting to appear kinder to their employees, or also for unions to negotiate more money for healthcare if that's the way they chose to go, rather than have it going into wages. So, and there's reasons for both ways, for, again, mostly for federal tax purposes. So to me, that's one of the things we maybe want to think about is, should we do something like marginal payroll tax rates? And if so, what they should look like, and should it be some amount exempted? And another question related to all of this for the payroll tax is, how much for each employee's wages should be exempt from the payroll tax? And should it be based upon easy things to collect, or should it be based on poverty level? You know, so number of exemptions perhaps from the W-2 form already, or on poverty level that they'd have to submit something to their employer, or should it just be some basic amount? So there's lots of detailed questions about the tax structure that we need to be thinking about and make recommendations for, and we could ask Eco Northwest to analyze them, but I think it's up to the committee to decide what do we want to recommend. And again, I would say very strongly that all of these questions are probably things that we want to have a lot of community discussion about. We put out some possibilities and we get feedback from the community to say, does that look fair enough to you? And is that, or do you have some other way of doing kind of the same thing that we could get enough money that you think would be fair? And so to me, we need to have a lot of committee discussions about a lot of these detailed suggestions that we might make. So I'll stop there.
Thanks, Charlie. I jotted the questions down myself, so thank you. Jenny?
I just wanted to follow on with what Charlie was saying. I think he's correct, and those are really some things that the committee needs to take under consideration. And then we don't want to leave out the aspect of where once the committee gets to a point where they do feel like there is a direction that they want to take, taking that to the board and getting the board feedback in terms of whether or not the board agrees with the direction that the committee wants to take, and ensuring that we have the time to both let the committee have those conversations, allow the board to have those conversations, and then include the community outreach that I know has been brought up in this committee before, and taking some of those considerations out and having those conversations before we move even further down the path of trying to institute them, or really getting into the nitty-gritty of modeling them. So I really appreciate that, Charlie.
Yeah, totally agree. I think, and I do think we need these options like side by side so we can just see them right across the sheet. So I think this is a good time to, oh, we have another raised hand. Jenny, is yours now? Okay. One more hand, John. And then I want to move on to next.
I was listening to that discussion. I think in Chunwei's talk, maybe and some other principles, we've talked about making it easy for the individual to understand who's paying for what and what they're paying for the healthcare. And as I sit here and listen, I think the payroll tax is a mechanism that will be the easiest. I mean, when I pay income tax, I don't really know where the hell it's going. It's going into the government, and it's being sent in various different ways. I'm okay with that, but I have very little idea about actually what it's going to. One of the positives of a payroll tax would be people would realize, here's how much my employer is paying, and here's how much I'm paying. There's some good aspects to that. Just wanted to say that.
Thanks, John. Charlie?
I just wanted to add a little bit to that a necessary reason for the income tax is that there is income that people have that is not from wages, and we need to get money from that. And some of the wealthiest people have. So we actually do need it for a lot of reasons, but that's one of them. So I'll stop.
Don, are you in favor of that? I couldn't tell from your hand movements.
Yes.
Okay, all
Yeah,
right. I wasn't sure if you were waving no, or.
I was no.
All right, okay.
Absolutely in favor of an income tax, and I believe that the best thing would be for that to be clearly devoted to the subsidies to Medicaid, and for Medicare and employed insurance to be funded more through strategies like we've talked about, so that the individuals in those two groups could see, well, here's what I'm paying for my health care. And then over here on the income tax side, some of this is going towards what I support happening in terms of Medicaid. Does that make sense?
Yeah, thanks, John. So I'd like to move into meeting reflections and next steps. And I jotted down things that I thought we could list here, and I'm sure I missed some things, but so please chime in. So I've got the kicker issue. We still need to stay on top of that, and that's in the works, as Jenny noted. We need to address or readdress reserves from existing health plans, what we're going to do with that. And I noted Chunwei's Chenway's comment about tying taxation with reserve, like having 1 to 3 months reserve and then increasing or lowering the tax accordingly. I also heard, and this came from Chenway as well, that we need probably a worst case scenario option if Medicaid and Medicare are, I don't know, destroyed or something. I can't think of a good word to say, but so I think I agree that we're gonna need to do that. Let's see. And then we were told that Echo Northwest is just onboarding and that we need to schedule, well, probably our next committee meeting, we'll need to go through, we'll hear about their scope of work, and then we have started a list of questions or topics that we want them to tackle. So I know staff and I have too been writing those things down. So maybe we need to have that discussion next time on what's within the scope of work for Echo Northwest. Was there anything else that I missed in terms of what we need to work on, Charlie?
On the reserve question, there's also one other thing that you didn't bring up. It's not just existing health plans, but it's also existing provider reserves that John had brought up. So I think we need to think about that as well. And I would say related to that, and this is sort of a bigger question about what are we thinking this the health plan will be paying for. And among those things that it could pay for that I don't think has really been decided are structures and equipment. And structures and equipment are currently funded from essentially excess money that that providers get that they put into reserves so that someday they can buy more equipment and get better facilities. They also do some other things to get there too, but those things are all sort of tied together, I think, and it's unclear what we need to have discussions about that, and not just within our committee, but within the governance board as well. So
Okay, good thought. Thanks, Charlie. Jeff?
Yes, thank you. This will be a topic of future discussion with the state legislature passing, and I think the governor's going to be signing the renewal of the 2% assessment on health insurance plans and the 6% assessment on hospital net revenue. Under a universal single payer plan, there are no longer going to be individual plans to have that 2% assessment gathered from. So that's another revenue that would disappear that is currently available.
Yeah, thanks for bringing that up. I don't think we had talked about that before, not that I recall. Richard?
I welcome Echo Northwest joining us, and I don't want to get ahead of the process too far, but the thing that I'm most looking forward from them early is to start getting some rates in front of us for employer premium and for income tax, because where I'm going with that is we need to start building right away those personas about how when we go out in the community, but even before we go out in the community, what's it going to do for the self-employed individual? What's it going to do for the small business person? What's it going to do for the person who gets commercial insurance from their employer? What's it going to do for the person on Medicare? And then also double that, and what's it like for them in a year where they don't get sick or injured, and what's it like for them in a year that does get sick or injured, and start building those personas, because that's what we're going to take to the people. We're not going to take some grand document that says 59 billion here and in 2025 or whatever it be. We need to go with them and say, what's your life going to be like? How is it now? And what's it going to be like under the new plan? And we have to start building towards those personas. So not trying to push Echo Northwest, but that's what I'm looking. We need to have a good story for each a person and a family in each of those different scenarios if we have any chance of winning over the people of Oregon. Over.
Yeah, I 100% agree. That's the only way that we will be successful. Thanks for bringing that up, Richard. Jenny?
I just wanted to comment on two things. One was when Charlie was discussing what the plan will pay for in including in terms of medical equipment and so forth. That really is going to be the purview of the plan design committee for them to start considering and talking through. And when finance and revenue and plan design come together to sort of have those conversations about what that means and what can be in and what can be out. And so there is another committee that's going to be coming up and making recommendations about those types of expenses. And second, I wanted to speak to what Richard just said and some of what was said earlier in terms of, particularly in terms of community outreach, and remind everyone that when the community engagement and communications committee starts doing this outreach initially, particularly in this midpoint where finance and revenue has come up with a plan that the board has said, okay, move forward, let's find out more about that. And plan design has come up with some of their recommendations. The first groups that really are going to be targeted for that engagement isn't a broad community scope. These are really the individuals that are outlined in the legislation. These are the providers, these are hospitals, these are insurers, to get feedback and try to really engage with those individuals. Just like John was saying, having those conversations, bringing that information to them and getting that feedback, you know, to the best of our ability, and trying to get them to really engage with us so that we can bring that information back into the conversation as we take on sort of that second phase of realigning the plan with the income that can actually be brought in and the considerations that we get from those different targeted groups. And then in the future, having more broad community outreach and letting the community sort of know this is the structure that we've agreed to or we've gotten feedback on with the providers and with the insurers, then getting that community feedback. And I just wanted to really sort of level set for everyone how that process is going to move forward and when those different constituencies will be providing information.
Thanks for that reminder, Jenny. And of course, it's important to get buy-in from the payers and providers too. We would also fail if we don't. John?
Yeah, just a couple of random but connected comments. I heard last night that there's a bill at the legislature that appears to be making progress in which schools are asking that a fund be created that would be immune from the kicker to be available to repair school buildings in districts that don't have the money to repair their buildings, to build new buildings, to do significant repairs. It would just be interesting to make sure we're following that, because there's going to be a discussion there about kicker. Jeff's comment about the provider tax. We did talk about that at the task force. The actuary pointed out to us that, you know, that 6% is going to have implications, and it is significant. But I also wanted to point out, so that's another 6% of hospital revenue that should be added to the list that we don't need to pay for. So their budget, if you would, comes down because there's not money being laundered through the hospitals or through provider organizations. And it's more transparent. And finally, I can't resist, you know, again, through the legacy OHSU and the other HCMO things, realize the standard in the hospital industry, the standard for reserve, quote, reserves is 200 days of revenue. You want to have 200 days of revenue in a reserve account in a hospital. Why? Because you've got bonds, and the folks who loan you that money see you having that size of reserves as reassuring that they're going to get paid. Recall that Chun Wei said the country of Taiwan only holds 30 days of revenue in reserve. So again, to get just some magnitude of the large amounts of money that are sitting around in the Oregon healthcare system, you know, the money is there. the money is there to do things differently.
Yes, agreed. So with that, I'm gonna probably lean on Jenny and maybe Kim a little bit on next meeting's agenda topics. Like I said at the beginning, I know we were trying to get the administrative cost panel together, but we were having trouble with scheduling, so I'm not really sure how we're going to do that. So could you help me out with that, Jenny, in terms of
Yeah, of
next
course.
meetings?
Of
Yeah,
course.
thank you.
I got the names of 3 different individuals who were recommended for the administrative cost discussion, and I've reached out to them. We're having some back and forth in terms of trying to find a time where all of them are available. So I'm not sure whether we could look for that type of group in early April, or whether we would look at them in late April. And so as soon as we get some clarification from the scheduling, we'll let everyone know when we might be able to have that discussion. And I think setting aside the administrative structures conversation, I did want to say about administrative structures and remind everyone in the committee that that's also an issue that's going to be taken up by the operations committee as well, in terms of looking at administrative structures. And so it really is going to have to work a little bit in tandem between finance and revenue and the operations committee, as operations gathers more information about structures and how to, so far we've looked at public corporations, and we're moving into this treasury discussion, and that's going to inform structures as well. And then I think once we have Echo Northwest fully onboarded, we'll probably have a work plan review that kind of goes back and looks at some of the work the committee's already done, which Echo already has all of that information. Give them some time to interact with it and sort of absorb it, and then go back and have those initial discussions and try to finalize some of that initial conversations around health expenditures in the state, and really nail down what we think the number there is between what the work Charlie's done and the work that Echo does, and then take another look at revenue streams and really come to a recommendation and take that to the board. So I think in the next couple meetings, we'll take that first look at administrative structures, and then we'll do some review of some of the previous work and get those numbers finalized.
And
Richard?
Can you just say a
Oh,
little
sorry.
more on real quick, Jenny, on the onboarding, the formal onboarding of Echo Northwest? Is that next week? And I just don't remember. So what would the timing be then for having this, starting this discussion of, you know, all the questions and possible topics we can ask them to help us with? Just
Sure.
trying to figure out
Thanks.
the timing, yeah.
Thanks for that, Cheryl. And I think that's really important to discuss. As most of you, if not all of you know, the board has just hired a new executive director who will be coming on in April, in the first couple weeks of April. And so there's probably a likelihood that that initial kickoff meeting to really drill down on the work that Echo needs to do would be done with that executive director onboarded. And so it might not be for another, trying to think of what week we are in. It might not be for another 2 weeks where we really have that work plan review and look at the work of Echo, because we don't want to move ahead of that new director being onboarded and having the ability to have some of those conversations with Echo as well. Additionally, some staff will be out of the office, and so we're going to need to kind of work around that as well, which is why having the possibility of the administrative structures conversation might be a little bit of a stopgap in there to have that conversation while Echo gets fully brought on board and everyone who is new to the board gets updated.
So Jenny, right now I have holds on my calendar on April 1st and April 15th. So do you see that deeper discussion and understanding scope of work of Echo Northwest being on like April 15th as a possibility?
I think that's hard to answer at this point, given the timing of the new director being onboarded. I think that it is, and the timing needed for posting. I think it's possible that conversation could happen April 15th, but it may not be, it may be the first step in the discussion where I laid out, like, we need to look at health expenditures and we need to look at nail down revenue. It may just be a smaller part of that for the committee to sort of formally recommend something around health expenditures, which really they've done in terms of setting that the benchmark dates. So I think that
So I just want to check. So would we not be meeting on April 1st and then doing the administrative costs panel possibly on the 15th and or on the health expenditures then, or?
I am not 100% sure, because if
Mm.
we can bring in the people to talk about administrative structures on April 1st, that would be a great
Oh,
middle
okay.
meeting. But if
Uh-huh.
we can't make the calendar times work,
Okay.
it wouldn't be feasible to have the meeting that we're talking about with Echo Northwest on
Right,
April 1st.
right. So basically stay tuned, and if we can get it together on April 1st.
Yeah, we're just in a little bit of a transition period right
yeah.
now.
Yeah, otherwise it would be April 15th then.
Yes, absolutely.
Okay, Richard.
On the issue of interviewing administrative cost experts, I'd say that if we're trying to schedule that with this group or with this group and another committee, that well, let's look for, if we can't all make it, that we go ahead and have the committee or have the meeting with the experts as we can with those that can make it, and just video it. And use that we got to get their expert opinions on board, and then we can go back and ask them more questions. But we don't want the perfect to be the enemy of the good, and let's go ahead and video, and then we can follow up. If we miss the meeting, follow up, watch the video, and ask more questions. Over.
Sure. Okay, that's a great idea. Charlie, did you have your hand raised, or?
I was just going to say that I will not be available on April 1st, so I'd prefer that the expert people are the panel that we're thinking about not be April 1st. That'd be my preference. So
Same here. I'm not available on the 1st.
Okay, thanks, Bethany. So that's all I've got, unless anyone has anything else that they'd like to suggest for the next couple meetings of topics. I know there's a lot in flux right now with the new executive director and onboarding Echo Northwest. So we're trying to work that out with the timing. So anything else you'd like to say about that, Jenny? No? Okay. And as far as I know, there's still no verbal public comment. Is that right, Katie?
Correct.
Okay. So we received 3 written comments, and we do, for anybody who's listening, we do appreciate those written public comments. I know I read them, and there's always new insight in those public comments. So thank you very much, and keep sending them in. John, did you have something else?
Yeah, I just wanted to put in a plug. I think Bruce Thompson submitted a public comment of a document that comes from a medical director kind of person in Hawaii. And on the last page, he has a list of 12 bottom line recommendations. And I would especially urge folks to look at those recommendations. So I personally think they are pretty consistent with the direction that we're going, and are just a nice list of objectives, if you will.
Thank you for pointing those out, John. I'll take another second look at those too. All right, so with that, I think we're done, unless there's anything else to talk about here in next steps. I mean, we're working on it. We have lots and lots of questions and comments, and we'll see if we can make it happen on April 1st with the admin costs, but I know a couple of you said you'd prefer the 15th anyway, so maybe that's the direction we're going. I don't know. So, but just watch your email, and we'll keep you posted as new developments arise. Also, if you have other questions or comments that come to you, please email, I would say, Jenny, Katie, and myself, and we'll keep track of those comments, and we'll forward them to Echo Northwest too. So with that, we're going to adjourn. Thank you very much. This is a really good discussion. Appreciate all of you.
Bye-bye.
Thank you.
Have a good rest of the week. Bye-bye.
Thanks.